Hey guys, welcome to Medifaction. Today, let's learn about myopia or nearsightedness. So, myopia is a common vision condition in which you can see objects near to you clearly, but objects farther away are blurry. So, basically, the refractive errors are divided into two types, spherical kind and cylindrical type. In spherical type, we have myopia and hypermetropia, whereas in cylindrical, we have astigmatism. Now let's learn detail about myopia. So in myopia, the power of the eye is actually more and the image is formed in front of the retina. As you can see, this right here is the retina. The image is supposed to form here, but in case of a myopic patient, the image is formed in front of the retina. Now let's learn the classification, that is according to etiology. First we have axial myopia. So this right here is the condition called axial myopia, and this results from the increase in the see right here you can see the posterior, right here the posterior length of the eyeball is increased. This is the normal condition, and here you can see it is elongated, and due to that the image is formed in front of the retina. And this kind of, that is this axial myopia, is the most commonest form. Next we have curvatural myopia. So this curvatural myopia occurs due to increased curvature of the cornea or increased curvature of the lens or increase in curvature of both of these cornea and lens. Next we have positional myopia. So this positional myopia is produced by anterior placement of crystalline lens in the eyes. This right here is the crystalline lens, and this crystalline lens will be positioned anteriorly. Next we have index myopia. So this index myopia results from the increase in the refractive index of the crystalline lens, and these may be associated with nuclear sclerosis. Next, we have myopia due to excess accommodation. So this myopia due to excessive accommodation occurs in patients with spasm of accommodation, and there will be prolonged contraction of the ciliary muscle. Now let's learn about the grading of myopia. There are three types of grading, which is low, moderate, and high. In low myopia, the error will be less than 3 diopter, whereas in case of moderate myopia, the error will be between 3 to 6 diopter, and in case of high myopia, the error will be greater than 6 diopters. Now let's go in detail. We can learn about the clinical varieties of myopia. First of all, we have the congenital myopia. From the name itself, this will be present since birth and is usually diagnosed by the age of 2 to 3 years. The anisometropia is usually present. Hence, most of the time, the error is unilateral, that is, on one side, and rarely it may be bilateral. There will be high degree of error, that is, about 8 to 10 diopter is usually present, which mostly remains constant. Convergent squint, as you can see here, this right here is the convergent squint. It may be developed in order to preferentially see clear as its far point. Associations may include other congenital anomalies such as cataract, microphthalmos, megalocornea, and congenital separation of retina. Early detection of congenital myopia is desirable. Next we have simple myopia. Simple or developmental myopia is the commonest variety. It is considered as a physiological error not associated with any disease of the eye. Overall reported prevalence is 20 to 40% of population. Since the sharpest rise occur at the school age, that is between 8 years to 12 years, so it is called school myopia. Since it is commonest type, let's learn about some of the symptoms of school myopia or simple myopia. There will be poor vision of distance, that is short-sightedness is the main symptom of myopia, as we all know that. There will be half shutting of the eyes, as you can observe right here. There will be half shutting of the eyes may be complained by the parents of the child. The child does so to achieve the greater clarity of stenopic vision. A change in psychological outlook of the corrected myopic children is very common. Due to poor far vision and normal near vision, the children become introvert, studious, and develop little interest in the outdoor activities. So these all should be noted. Next, we have another important type of myopia, which is pathological myopia. It is otherwise called as degenerative progressive myopia. As the name indicates, is a rapidly progressive error which starts in childhood at 5 to 10 years of age and results in high myopia during early life, which is usually associated with degenerative changes in the eye. Actually, it is less common, that is, it occurs only about 2% of population. Now let's see some of the symptoms of pathological myopia. First of all, there will be defective vision. There is considerable failure in visual function as the error is usually high. Further, due to progressive degenerative changes, an uncontrollable or uncorrectable loss of vision may occur. Next is muscae voluntatis, that is, floating black opacities in front of the eyes are also complained by many patients. Like these type of images will be formed in front of your eyes, and these occur due to degenerated liquefied vitreous humor. Difficulty in night vision may be complained by very high myopes having marked degenerative changes. So this right here is a etiological hypothesis of pathological myopia. So the genetic factors play a major role, and the growth process, that is the general growth process, plays the minor role. And both of these contributes for more growth in retina and results in the features of pathological myopia, which are increased axial length, degeneration of the choroid, degeneration of retina, and degeneration of vitreous. So now let's learn about some of the fundus examination reveals of this pathological myopia. First of all, the optic disc appears large and pale, and at its temporal edge a characteristic myopic crescent. Right here you can see a characteristic myopic crescent is present. Sometimes peripapillary crescent encircling the disc may be present where the choroid and retina is distracted away from the disc margin. A supertraction crescent where the retina is pulled over the disc margin may be present on the nasal side. So here you can see the temporal myopic crescent. This right is the retina, and this right here is a sclera. Next is degenerative changes in retina and choroid are common in progressive or pathological myopia. These are characterized by chorioretinolathrop patches at the macula with a little heaping up of the pigment around them. Next is Foster-Foucher spot. Here you can appreciate this dark red color circular patch due to subretinal neovascularization and choroidal hemorrhage, and these may be present at the macula. Next we have cystoid degeneration may be seen at the periphery, and another characteristic feature is lattice degeneration or snail track lesions with or without retinal holes or tears may be present. Right here you can appreciate, which later may be complicated by retinal detachment. This right here is the lattice degeneration. And also, total retinal atrophy, particularly in the central area, may occur in an advanced case. Next, we have posterior staphyloma due to ectasia of sclera at the posterior pole may be apparent as an excavation with the vessels bending backward over its margin. Right here, we can appreciate. This is posterior staphyloma. Now let's learn about the treatment of myopia. First of all, there is optical treatment of myopia, which comprises prescription of appropriate concave lenses so that clear image is formed on the retina. These are the light rays. These are the concave lenses. You can see the concave, and because of this concave lens, the rays will be formed at the proper retina. And the modes of prescribing concave lenses are spectacles and also contact lenses. The contact lenses are particularly justified in cases of high myopia as they avoid peripheral distortion and minification produced by strong concave spectacle lens. And also, surgical treatment of myopia has become very popular nowadays. Thank you for listening. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.